So Sandra, can I ask you something? What's Rosa, the robot? I just noticed that.
Oh, yeah, if you join us on October 29th, you're gonna find out.
I like it. Wait, is the robot going to be on Zoom?
Mm, I'm not sure, but pictures will.
Okay.
Pictures will. Okay, so let me see how many people we have. Okay, let's get it started because it's 12:02 already, and we want to make sure that we get time to answer all of our questions. So thank you very much to all of our participants for once again joining us. As you were seeing on the slides, we have a lot of events planned from here until really the end of the year and almost end of January now. So these Zoom chats have become very popular. Once again, we have here Dr. Roy and Katie Howell, which I'm very happy to have with us today to talk about palliative care and how can palliative care help you live well. That's our topic today. Now, palliative care is fairly new, and probably a lot of us don't know much about it. So Dr. Roy and Katie, who are the experts today, will be telling us more about what palliative care is, when to use it, and just a reminder to please use the Q&A box or the chat box to send all your questions, because we're going to have all your questions answered today. So let's get started. Dr. Roy, do you want to tell us a little bit about yourself and how you became acquainted with palliative care?
Sure, of course, and thank you for having us, Sandra. And so I'm Dr. Roy. I work with Katie here at Monte Nyack Hospital, and we're developing this palliative care department. And so palliative care is a very new type of concept in medicine. It's a new branch of medicine where it's very patient-centered. What we're trying to do here is develop this department to really bring back what is important to the person, to the patient in front of us. And so what happens all too often in life is illness happens. Well, of course it happens. We all are going to develop some type of disease or illness during our lifetime. But what's tough is when that illness hijacks your life. There's so many things that are important to all of us. And when illness strikes and it takes us in a direction that we didn't anticipate, sometimes those things that are important to us, they get kind of pushed aside, and we get started on this whole medical process. What we're trying to do here is we're trying to bring back that focus, bring back that control in a person's life, and that's what palliative care actually does. Palliative care works in conjunction with curative therapies, and we work very closely with your primary care, with your other specialty doctors, to make sure that whatever you want to accomplish and do while still getting treatment, that we can help you to do that. So there's many roles that a palliative care specialist and a palliative care nurse and doctor, what we can take. Sometimes it's about just understanding what's going on to try and make sense of life right now. Sometimes we're there just to help family to deal and cope, to take care of a loved one going through a process. Sometimes it's just simple things like helping with pain or nausea, a simple symptomatic management. But again, Pal Care, what we do is we try to basically help in all aspects of the care and help a person go through these uncertainties of life. So that's what Pal Care is. Did that kind of, Katie, what else do you think you can add to that?
No, sorry, I agree. It's a thorough explanation. I became involved with the palliative care department just because I currently work as manager of the patient experience department, but also have a nursing background. And I think just with our experience with patients and families, we've realized that there's been a need sort of to support patients and families through their illness. And so we thought this was a good opportunity to introduce this concept of palliative care in the organization. So that's what we've been doing.
Mhm. Is there any specific disease that you treat in palliative care? Like, you know, for example, we're used to medicine being kind of chunky, right? Like you have the heart doctor and the kidney doctor and the oncologist, and you know, so what's palliative care about? Like, what is it? The whole body? Is it a specific disease that you treat? What's the specialty?
So no, that's a great question, actually. So basically, so a pal care doc is well versed in all branches of medicine. We understand the heart, we understand the lungs, we understand the brain, we understand each of those aspects, but more so what we really focus on is how all of those things interact with each other in a person, but also how that person interacts with their family, their culture, their community. And so, in other words, any type of chronic illness that is hijacking a person's life. So that's such a broad topic. In other words, let's say somebody has COPD and they're starting to have difficulty with breathing. Of course, they're seeing their pulmonary doctor and their primary care doctor, but the palliative care doctor can also help with the symptoms of difficulty breathing, on making sure that a person is going through the process of helping with their family, being able to take care of themselves at home. The PAL care department would help with maintaining as much independence as possible, because that's usually what's very important to a person. We see patients that have heart failure, that have diabetes, that have any type of cancer, that are on dialysis or have renal disease. And so it more so has to do with how functional a person is. And so that's where we actually see all patients with all types of chronic illness that's starting to progress. So it's more so about how each organ is affected, sure, but it's again how they interact with each other. So we see everything basically.
Okay, so just to clarify, the COPD, that's chronic obstructive pulmonary disease, correct? So the person is going to have difficulty breathing, a lot of symptoms. The disease is going to progress at some point. So when this progression starts is when we want to make sure that the person is still functioning.
Yep.
And that's when palliative care comes in, correct?
Yep, exactly. And so we also can help support the person, making sure, because COPD is very life hijacking. You can't go out as much. You can't do the things that are important to you. But also, you know, we want to be able to start talking to family or getting that support. And so what PalCare does is it helps to bridge those different things that are important to people. And so in other words, we're bridging the medical aspect with a person, and we're making it much more seamless. What's important is that we actually have that time and we focus our attention all on the person, the patient in front of us. And so our specialty is really the patient. So that's kind of what we do.
So now at some point, I think that people might be wondering, oh, okay, so for example, I have diabetes and now I feel that I want to seek palliative care for diabetes. Is that going to replace my regular visits with my primary provider or my oncologist? Is this a replacement?
Oh, not at all. So I have actually had a lot of patients that did only see me after a while, but it's actually not not to replace. It's actually just to help support and help help a person to understand. Sometimes when a patient is visiting with their primary care or their specialty doc, sometimes they forget a question to ask, or let's say something just didn't make sense. That's where we can kind of plug those gaps to make sure that a person feels fully supported. So we're complementary to or supplementing that care. And so what's good about our department is we're able to keep our census, or the amount of patients that we see. We try to keep it low so we can give as much time and attention needed, so we can give that type of care. And we have obviously we have a palliative care nurse, we have a physician, we have a pharmacist that helps us, we have social work, we have pastoral care, and so we really try to capture everything that a person needs in order to make sure that they continue to thrive. So.
And Katie, you are a nurse. So from the point of view of nursing, how does nursing help in palliative care?
Sorry, like Dr. Roy said, I think one of the advantages of the palliative care department is we have this aspect of time, and we're able to spend a lot of time with the patients. So in my current role, a lot of what I do is really history taking and finding out what's important to the patient, and making sure that we understand what their goals are, what their environment at home is like. And then we serve really as a liaison between all of the different departments. Another unique feature in my role is that even once the patient is discharged from the hospital and they go home or they go to their next level of care, if that's a rehab, we still try to maintain our relationship with them, and we stay in touch with them and the family. And we sort of extend ourselves as this continued source of support for them. So even if they're having concerns at home, maybe they're financial, maybe they're, they have emotional concerns, or they need an extra level of support, like Dr. Roy had mentioned, we can hopefully help facilitate that. So we work closely in an interdisciplinary team style, with social work, with pastoral care, with pharmacy, and we use them, as experts in their own areas to help make sure that we manage the patients and their families at all level of care. So when they're in the hospital and when they return to home, and then if they return to the hospital again, we try to continue that conversation with them that we started when we first met.
Mm-hmm. So going back to the comment that I was making a few moments ago, where we're so used to break down like the different specialties, it feels to me like palliative care is like a net that is bringing everything together for the sake of the patient, which is something that I feel we've been losing over the years with the new, healthcare system. It's like, we're divided in parts and everybody takes care of one part. And it seems like palliative care is this one specialty that is putting everything together again for the sake of the patient.
Yep.
I think that's a good metaphor, the concept of a net, because that is what it is like. I think a lot of times when we meet patients and families for the first time, they're overwhelmed by what their healthcare journey has been. And I think by taking time to get to know them and understand what their goals are, it brings them a sense of relief. And I think another message that we try to get across is that we want to empower them to be in charge of their own journey, and that it is not for us to decide what that should look like. It's really for them, but we function as facilitators in that process. So if somebody has been aggressively pursuing a curative treatment for their cancer, and they've done that because they've always been under the impression that that's the correct journey, but maybe they want an opportunity to talk about that a little bit and to kind of explore what different paths may look like. Mm-hmm. I think that we're here to support them through that process.
Mm-hmm. Now you've mentioned a word that is sticking to my head right now: family. So, because we always think of the patient, but definitely, a lot of these diseases, and especially when we talk about chronic disease, it does not only affect the patient, it affects the whole family. Something like diabetes makes the whole family, changes the whole family eating habits or activity habits, or cancer. It's the patient, but it's also the caregivers. If somebody's on dialysis, somebody has to help transport the patient. So it affects not only the patient, again, it's the families. So how does palliative care help the families and the support system of the patient?
No, that's a great question. So part of that is actually connecting the family together again, understanding where everybody is in their understanding of what's going on, but all too often a family member is taking care of a loved one, and so PAL Care can actually help with identifying if a person is starting to feel the burdens of that care, starting to feel burnt out. PAL Care also helps that family to be educated on exactly what is going on, so we know exactly what we can do to help them. Most of a lot of the meetings that me and Katie have are actually with the families, just to see, hey, how can we help you better to maintain the independence, to be able to give you a chance to live as well. When chronic illness hits, it burdens everybody. And so I think the first thing that we do is we are able to take the time to identify what a family needs, and then depending on actually what they actually need, we try to support those different things. Katie, what do you think?
Yeah, no, I agree. I mean, we bring up this idea of caregiver burnout, which we see a lot, and it's very common with chronic illness, with things like Alzheimer's and other dementias, where untrained family members who have no experience in healthcare suddenly find themselves in the shoes of the primary caregiver. And it's very overwhelming, and it comes with a great amount of sacrifice, even though they do it probably voluntarily. Of course, they want to help their loved one, but there are financial implications of it because they're unable to work. There's social implications because they can no longer carry on relationships with their friends. And it can be a very isolating situation. And I think that by the palliative care department forming relationships with these patients and these families, we can also recognize their role in this and their sacrifice, and listen to what their own healthcare experience has been, because honestly, it really impacts the patient and it impacts the family member. And then of course we have some support that we can provide them. If not just emotional support, we try to provide really practical support too. And we do that by working with our team and working with the social workers. And sometimes there's another layer that we can provide them out in the community when they return back to their environment, as care.
Yeah, actually with what you were saying, especially with because even just recently, we went through something very similar in our own family, and even being trained in palliative care or in hospital medicine or what have you, taking care of a loved one is tough. I'll tell you, it just takes everything out of somebody. And so even those of us in healthcare, when we have to take care of a loved one, since we're emotionally connected to the person, it's difficult. So for us, when we went through it, PAL Care just really helped me through, because it's difficult to see someone that you respect and care and love to be in a situation and feel helpless, to be honest. And so that's where having that extra support is needed. And so and that's what we try to do here. Again, when we went through it in our own family, I was just, without that care, without that extra support, I don't know what I would have done,
So palliative care, like how do we access palliative care? Like, do we have to ask our primary care provider to refer us, or we just seek it ourselves? Do we need a referral? Like what's the way if I want to find palliative care for either myself or a family member?
Sure. So actually, initially, when we were developing this whole program, we were hoping to develop the outpatient department. And it actually, we were supposed to open up in March of this past year, March 2020. But with coronavirus happening, they had me instead uh, create an inpatient one. So when we're in the hospital, the best way to get in touch or to have a palliative care doctor be involved in the care is just asking any one of the care team, whether it's the doctors or the nurses or even a family member, and usually it comes to us fairly quickly. In the outpatient setting, it's a little bit, it's tougher. I think right now in Rockland County, there aren't too many physicians and nurses that are practicing it, but it is starting to grow. The best way to really ask is by asking the primary care provider. Hey, I'm interested in PAL care. Do you know of anyone that's practicing it? We here are trying to grow our department too, and we actually have an email address and a phone that if somebody has any questions on how to find a palliative care provider or just having questions in general, and I'm sure we'll give that contact info towards the end, maybe. I'm sure Katie's got it.
We will. Yeah, I'm armed and ready.
Yeah, you can actually give it to me and I can put it in the chat box. Do you know the phone number? 845.
Yeah. I think Katie has it, yeah.
Yeah, 587.
Okay.
8326.
8326. Okay, I got it. So it's in the chat now. Okay. And when will be the best time to refer? Like, well, yeah, when will be the best time to refer? I have another question following that one.
Yeah. So honestly, if a patient or if a person is thinking about palliative care, it's already time to refer. So in other words, if they're thinking, oh, should I get in touch with a pal care doctor? Yeah, usually that's already the right time. But what it is more so is the earlier it is, as soon as a person has a chronic illness that they're dealing with, that they're starting to see that they're not able to do as much as they used to. Recently actually I have had a patient who has a cancer diagnosis and very active, but then she started to realize that, wow, my shortness of breath is just getting worse, or I just don't have as much energy as I used to. I don't want to tell my family, but things are getting harder. That's the right time. That's when it's about understanding that life is definitely progressing, and that, hey, maybe it's a good time just to tell somebody, and that way I can get that extra support. And so that's how we know. But again, if somebody has a question on it, they can easily ask their primary care or that number, and then we could help to guide them.
And I think just one other important thing about that, when somebody is diagnosed with a serious illness, like Dr. Roy said, of course, the earlier that palliative care gets involved, the better. I think a lot of times patients are used to compensating with symptoms that they have, and they're used to maybe not feeling the best, and they've adapted their life to their illness. But, or, they're having frequent trips to the emergency department or frequent admissions. But the other thing that's important to note too, palliative care can also help with the symptoms of disease management, or, for example, if a patient has a diagnosis of cancer and they're undergoing chemotherapy, the illness itself can be very debilitating and can cause pain. And there's a lot of psychosocial aspects of it as well. But also the treatment can be very debilitating. And so palliative care can also help manage the symptoms of disease treatment. And I think that's just another important message kind of to get across as well.
Yeah, and to kind of to also add, you had asked when to refer to palliative care. So what's interesting is a lot of times when do I get a referral? It's actually at the very end, like when it's usually at a point of hospice or end of life type of care. And so I think one of the things, or one of the pieces of confusion, is many people, whenever they hear the word palliative care, they think, oh, is that hospice? And it's not. It's two separate entities. And I always like to kind of talk to that, in that when it comes to medical care, there's curative care. That's, we give medications and therapies to get somebody back to their baseline. And then there's hospice care. Hospice care is when the curative therapies aren't really helping as much anymore. The side effects are becoming problems. And when curative therapies aren't helping, and we're trying to only give them symptomatic care, that's where hospice level of care is. And very often I get consulted when we're already at that hospice level. And so the in-between part is where palliative care really helps. It's when they are doing curative care, but they're having the symptoms that Katie was talking about, or the emotional support they need, because then they're just not falling off of a cliff. And we just try to help guide them down to that hospice care level. Does that make sense?
So if I'm understanding correctly, so palliative care helps you prevent to that hospice stage, correct?
Well, it can. Palliative care also helps while we're at that hospice stage. What pal care is, it's a bridge between the curative therapies of doing everything of curative care can offer, and what hospice care or end of life care has to offer. So palliative care is that bridge in between, and so yeah. So in other words, it helps to kind of help a person, rather than falling off of a cliff, to kind of walk down nice and easy.
Okay.
But
Yeah.
like Dr. Roy had mentioned earlier, palliative care is still appropriate when a patient is nowhere near hospice.
Exactly.
So if it's consulted at the onset of a serious illness, it can just be part of the plan of care, so that it ensures the quality of life that the patient is experiencing is improved and better, and that it's not debilitated by the illness.
Yes.
So really palliative care, because we don't replace the primary care provider, we're not a replacement for, they can still pursue curative measures, but we can be part of the plan of care from the onset of disease throughout the whole disease trajectory, and then once they transition to, hospice, if they do at some point. But
yeah, so it helps to really control, in a way, that disease, and it helps you to eventually have a better, it helps you to have a better quality of life all the way till the end, correct?
Yep, and actually, in many cases, it actually helps with quantity as well too, because a person is much more happier. They have much more. They're living their purpose, and it actually helps in prolonging life as well. In many cases, so that's what we focus on, both the quality and the quantity, and then when the time is right or appropriate, that we also help with the transition to hospice too. And we help that patient, that family, the whole care team. And so, yeah.
Yeah. Now, if you could explain, because we keep talking about chronic diseases. So if you could explain what chronic disease is, just to get a better understanding, because it seems that obviously palliative care, is most, it's better when we have a chronic disease. So what is that exactly, so that our attendees know exactly when to refer?
Sure. So a chronic disease, so there's acute, that's when something is happening now. And we treat an acute illness and that person gets better. that's when we hear curative therapies. So let's say a person has a pneumonia or a urinary tract infection. They come into the hospital, we give them antibiotics. After about 7 to 10 days, they're back to where they were before the illness happened. That's acute care. Now, chronic care would be when that infection either keeps happening despite the antibiotics, or they have an illness that is not going to go away. For instance, cardiac disease. Let's say somebody has a lot of plaques in their arteries, and their heart has a heart attack, and then they're having atrial fibrillation and all these different things that we hear about. The heart is in a chronic state in the sense of we're giving medications, but it's never going back to what it was. So it's something that kind of stays with us. Another chronic thing is like arthritis. I have arthritis in my knees, and unfortunately, it's never going to go away. And so now, sorry, the tough thing with arthritis is in the beginning, you're dealing with a little bit of pain, and but then as it progresses, there's difficulty with walking, there's difficulty with standing. And so that's how when a disease doesn't go away, that's what chronic is. So.
Okay. Usually when I talk to my patients about chronic disease, I like to say, if you have to take this pill for the rest of your life, that's chronic.
Yep. That's it.
You just have to live with it.
Yep.
Yes. Okay. So I think we touched a little bit on this, but how can palliative care help you age well?
Sure.
Actually, it's interesting because Dr. Roy just brought up arthritis, and we had an example of a patient actually who kind of had debilitating pain from an arthritis, or she had osteoporosis as well. So we had a patient that came in, she had had a fall at home. And when she first presented to the hospital, the plan of care was really around this fall. She had sustained a localized injury and then wound up with the cellulitis. So the plan for her was really IV antibiotics, and then she would transition back to her next level. But the palliative care team was consulted because in addition to having this fall, she did have some serious illnesses in her medical history. She had congestive heart failure, and the clinical team thought it was an appropriate consult. So as I got to know her as the palliative care nurse, I discovered that this wasn't her first fall. She actually had other falls at home. And the reason for those falls, she felt, was that she wasn't very mobile because she had this debilitating pain. When I started to talk to her about what she took for pain, she was telling me, and she said, if she took stronger medication, it made her really disoriented and lethargic. But if she took the less strong medication, she really didn't feel that she was able to mobilize well. And as a result, she, had kind of isolated herself a little bit, wasn't going out into the community, and wasn't spending time with friends. So I realized then in that meeting with her that we had a few problems. The most apparent problem was that really she had very unmanaged pain at home, and there were a lot of consequences to that. So we conducted a comprehensive pain assessment, and we found something that was more appropriate for her. We also worked with the social worker to make sure she had the appropriate equipment in the home. And we spent a lot of time talking to her and the family to find out what was important to her and what really her goals were. And she said that what was most important to her was this family trip to Ireland, but she didn't feel confident enough to go because she really wasn't ambulatory or mobile. So we were able to not only equip her home with the appropriate equipment for her to be independent and feel, have improved motivation to move around in the home, but we were also able to manage her pain better so that she could sleep better and be more mobile. And then we were able to help her realize this goal of going to Ireland with her family, which was very important to her. So this is an example of how palliative care can get involved with a patient that really has arthritis. She had heart failure as well. That at the time was being sort of well managed, but really what was impacting her quality of life most was her pain. And we were able to come up with a plan of care. Really just by talking to her and finding out what mattered most to her, we came up with a plan of care that helped her realize her goals.
So that's what it did. It helped her live well.
Yeah.
And Katie did an amazing job. I remember with this case especially. And it's kind of like, because her life was hijacked, Katie was able to identify a lot of these things and then bring it back. And it actually did a lot of good for this person. So no, that's a case that I'll always remember.
Yeah, me too.
And was there any improvement for the family as well, since we've mentioned the family?
There was. So as the palliative care nurse, as I said previously, a lot of what I do is just kind of follow up with the patient and the families after the patient has been discharged from our care. And she was, this particular patient was very close with her family, but their biggest concern was the safety of their mother in her home. That was number one. And two, you know, it was upsetting to them that they feel she couldn't be independent or didn't feel comfortable or confident enough to be independent. And I think by intervening and getting involved when we did and sort of troubleshooting these problems for her, we restored a lot of her quality of life. And that was very comforting to the family. They didn't feel they had to worry so much. They were already very involved and they were a very close family, which is wonderful to see, but it certainly gave them a level of comfort as well. And so, yeah, they were very appreciative.
It also got them motivated to make this trip to Ireland. So once the world opens up again, hopefully they can make it. But it kind of, you know, brought that light back into this, you know, back into their lives. So
yeah.
Is palliative care just for the elderly?
That's a great question. So it is for everybody. In the sense of so Pal Care, there have been cases where I've been involved with younger individuals, people with cancers that unfortunately happen, or patients that develop certain illnesses early on. So it is actually for everyone, anyone that's going through an illness that hijacks their life, essentially. Yeah.
So let's say that you are a patient with stage 0 or 1 cancer, breast cancer, and they do surgery, chemo, whatever they need to do, and you get cured, you know, but we know there is always a potential that you're gonna, you know, that you can have cancer again, that you can present with cancer again. So can a person like that start palliative care, and then I guess when the cancer is in remission, then palliative care is also going to be in remission, or is this something that can continue even though the diagnosis isn't there anymore?
That's a great question. Typically, we stay on through remission, just because there's a lot of things that happen in the mind when it comes to these types of illness. There's fear, there's anxiety, there's hope. All these different things happen, and so the PALCare specialist helps to guide a person through that, even after the cure is done. And hopefully they remain in remission. But if it does recur, well, the palliative care person already is on board and knows what's important to a person. So that's where the palliative care specialist tends to just stay on throughout, because they're that one consistent net that's always there. And so even cases where we see them here in the hospital and they get better and then they go home, they come back, hey, we're here. You know, we know your story. And that's what's important to us. You know, we love hearing people's story, and we love being a part of people's stories. So they can have as good of a story as they can. So just because an illness does get better, you know, we love to still be a part of the care just to help somebody through.
Mm-hmm. And just a reminder to our attendees, if you have any questions, please write them in the Q&A or the chat box. Let's take this opportunity to have experts here, Dr. Roy and Katie, to answer all of our questions. So I think I have one more question for you. How often do you need to see a palliative care doctor? Usually, you know, like you see your primary care, you know, for your annual every month, or, you know, you're kind of on a schedule. If you have diabetes, you see your oncologist every 3 months or 6 months. Is there a schedule also for palliative care?
That's a good question. So actually, it really just depends on what a person is going through. For instance, in the hospital, I'm seeing them almost hourly, sometimes daily. You know, it just depends on where they are in their trajectory. Early on, it could be when we're getting to know a person. It's usually once a week or once a month when we're in the outpatient setting. Once we're in the inpatient setting, it's usually every day that a palliative care specialist is checking in and making sure that we're going in the right direction. So
Yep. And I think too, one of the other messages we try to get across is that we are also available to patients and families when they feel they need us.
Yeah.
So we like to tell them if they need to reach out for any reason to feel free. It's certainly not a requirement, but you know, we want to make sure that, you know, we let them know that they can reach out to us whenever they feel they need palliative care as well.
Mm-hmm. So if I'm not an inpatient right now, but I've been a patient with a chronic disease, is there a way that I can still reach out to you even though there is no outpatient palliative care program at Montefiore Nyack right now?
Yeah, absolutely. And we're trying to be that support since this is such a new thing. And so that's where that phone number and that email address, that way we can try and help just guide a person to get the right information or to get the right care. We're definitely, since we're trying to create this, we're definitely trying to help as many people as we can.
Right. And even if somebody calls and we're not directly involved in their care, and I've received some of these calls previously, I'll certainly do my best to advise them the best way I know how, and I'll consult Dr. Roy for his advice too. And then we'll try to at least get them on the path to getting the questions answered that they need or the support services they need out in the community.
Mm-hmm. Okay. Is there, you know, since you connect the patients with so many different specialties, sounds to me like social work and maybe behavioral health are one of them, are some of them?
Oh yeah, absolutely.
Yeah. Okay. So let's say if there are financial issues, so not just medical issues, but are there any financial issues, depression, things like that?
Yeah.
Palliative care can help with that as well, correct?
Absolutely, yeah. We try to either we take on the role directly, or you know, we definitely connect them with somebody that can help in that role. And that's where it's such an interdisciplinary or multidisciplinary thing, and we all work together for that person. So yeah, no, we have a social worker that helps, a behavioralist that also will be helping, and so, but again, that's mainly on the inpatient side right now. On the outpatient side, we are definitely working to create that. So.
Mm-hmm. Okay. So any further thoughts, something that you think our attendees will need to know about palliative care?
Sure. So I think the main thing is we take the time, we want to take the time to give a person the attention to help them through. That's the main thing. And ever since we started doing this, personally, it's been an awesome experience for me too. The chance to meet all the families that we have been and helping these patients in all aspects of their life. And it's actually been a growing experience for me too. I just love doing it. And I think Katie's had a similar experience too. And so I'm just happy that, you know, we're able to provide this here at Monty Nyack.
Yeah, I
Beautiful.
agree. It's been very humbling, but very rewarding. And, you know, it's great to have the opportunity to develop all of these relationships with people that come into our lives and, you know, to be able to provide support to them and hopefully some services that are really going to help them. We know it's a very, very valuable mission. And I think we both agree that we're just so proud to be involved in it. So.
Yeah, that is great. And it sounds like a great opportunity for our patients as well. I mean, you know, I think a lot of us know at least one person in our family who suffers from some type of chronic disease, and knowing that they can get this support, it's really awesome. So I would like to extend an invitation on your behalf, of course, you know, to call this number 845-587-8326 and find out more about palliative care and how it can help not only your loved ones, it can help their family members, it can help you. You know, sounds like it's a great opportunity to help prolong the life of the patient, increase functionality, make everybody feel better. And, you know, sometimes when we have chronic disease or someone in our families has chronic disease, we kind of start losing hope. Sounds like this is a light in the middle of all these, you know, issues that we have.
Yeah.
Yes. So they're asking me to put the number again in the chat box. So I will certainly do.
Do you have it in front of you?
587-8326. Yes, I do.
Okay.
Yes. Let me see. There you go. Sending again.
Perfect.
Yes. So if we don't have any questions from our attendees, I'm gonna just thank you very much for teaching us about palliative care. I think that is not very knowledgeable, and you know, like, this actually exists. I think is great that we can offer this service here at Montefiore Nyack, or maybe somewhere else. Like maybe people can just ask their primary care providers if they can access these services. But sounds really like a great opportunity to have a better life.
Absolutely.
It's great. So thank you so much, Dr. Roy and Katie, for joining us today. And for our attendees, if you would like to see this again or share it with your family members or people you know you think might be helpful for them, I'm gonna be posting it in YouTube. I'm gonna be sending you a link, and help us spread the voice about palliative care. I think it's gonna be great. Thank you, and have a good rest of your day. Bye-bye.
Thank you, everyone.
Bye.
Bye.